I wanted to share a little bit about one of the ways I prepared, I guess, leading up to my BSO surgery in September. And one of the things so I created a CVR, which is a context vision results document that helped me and is helping me to keep focused on my intention for my surgical journey. And the context that I have is compassionate self-advocate. In alignment with that, I had conversations with an OBGYN, surgical OBGYN, who is going to do my surgery, or was one of the physicians who was potentially going to do my surgery. And I happened to have my first appointment on the day that I also had to make a very tough decision to say goodbye to my dog. And so I was in a state of survival and panic and grief and sadness and one of the things that I really recognized while doing that was I wanted and needed to attend to both things. So I made my appointment with him, meaning I managed to keep it, and I shared with him what was going on and said, I may have more questions. I may need more time with you to ask more questions, but this is important to me that I'm here. And also, I need to leave at this particular time, on time, so that I could go care for my beautiful, sweet Ellie Schnauzer. So we had a good conversation. I had everything, I had 50,000 questions written down on my iPad. I went through as many as I could, and he gave me lots of information and was really good. And at the end of it, he said, which most doctors offer, is if you have any more questions, just call my office and make an appointment, and we can have another conversation. So as my surgery got booked and we were getting closer to my surgery, I ended up realizing I had more questions and I wanted more specifics about, in particular, hormone replacement therapy. And we had talked about that in our first conversation, and he had said, yes, hormone replacement therapy is something that can happen. And as we got closer, I wanted to understand what that really actually looked like and the details of it. And so I called and booked another appointment with him, which may seem like a small thing, but it felt very much like advocating for myself instead of just hoping that I would get the information that I was supposed to get and that I needed. I wanted to understand ahead of going into surgery, especially since I was actually having surgery completed by two different surgeons, not him, because there are four OBGYN surgeons out of that practice, and they basically tag team. And so it wasn't him that I was going to be seeing on the day of surgery. And so I made another appointment and I spoke with him. And in this appointment, I said, okay, well, I'd like to understand more about how hormone replacement therapy starts and when it starts and dosage and those sorts of things. And he kind of waffled and he said, well, usually we only do hormone replacement therapy. It's kind of a wait and see, wait and see how your symptoms of menopause are. And I was surprised and caught off guard by that because all the information that I had received from my research and from the high-risk cancer clinic was that I was, at my age, was basically supposed to go on, or the best recommendation was to go on hormone replacement therapy until I'm 50, to ensure or to take care of my bone health and my cognitive health and my heart health, because generally there's estrogen in the system for sure until about 50. So I was concerned about that, and he said, well, I can give you hormone replacement therapy. And I said, yes, please. Like I that's what I believe is supposed to be happening. And so he wrote me a script. He didn't push back or anything, but I was so glad that I had another appointment with him. And I got off the phone and I was very unsettled and ruffled and worried about it. And instead of just taking his word for it, I slept on it. And then the next day I was like, okay, what can I do with this? How can I find out more? And so I'm a patient of the BC Cancer Clinic high risk cancer group, which means that they have a physician who helps you navigate being a hereditary cancer gene carrier. So I'm a BRCA2 carrier. And so there is, they stay up to date on the research and what the recommended course of actions are, and screening and hormone replacement therapy, etc. And so I immediately sent an email to the high-risk clinic, and within an hour, the physician got back to me and said, this is, so your OBGYN doctor is wrong, has given you inaccurate information, and independent of whether you're having your breasts removed, independent of your symptoms, at your age, at 42, you should be on hormone replacement therapy until you're 50. The research says that is the best way to maintain your health. And then she asked for my OBGYN's contact information so that she could help educate him. And I noticed I felt like I'd done something wrong, because my brain went to getting someone in trouble, getting the doctor in trouble. And then I thought, well, no, I mean, we're educating someone. He's a young physician. He's probably mid-30s, like not that far out of his specialization. He's practicing in a small town where most of the people that they, like a big majority of the patients they see are women older than me, and with different in different situations than me. The hereditary cancer situation isn't that common, especially in small towns where we just have a smaller population. And so, grand scheme of things, I helped educate him as a new OBGYN, and I found out that yes, I'm supposed to be on hormone replacement therapy, and that I then knew I could prepare. So I got my prescription. I knew that I had to start taking the replacement therapy the day after surgery, and that went well. So I was one of the ways that I met my context, which was compassionate self-advocate, was following up with that physician. So that's a little piece of my story on my BSO, bilateral salpingo-oophorectomy surgery, which is removal of ovaries and fallopian tubes. Thank you.